Well, I think that some of the challenges are to be able to understand these complex regimens, because I think sometimes when we think of cancer therapies, we think of just the cancer therapies. It's not really just the cancer therapies, it's also the supportive care therapies that are added to these combination therapies, taking into account antiemetics, taking into account pain medications, taking into account antibiotics that can be used to prevent infections. So it actually can be quite a number of volume of medications added to their existing number of medications, depending on if they have diabetes, hypertension, dyslipidemia. So it's very important to make sure that the patient is actually able to manage their medications at baseline before we add combination chemotherapy and then all of the supportive care therapies that get added to that mix. So I think that that's an excellent question. I think that that is an area that there is sparse literature in terms of improving fragmented coordination of care. I think that's an area that actually requires a bit of attention, because there really is not a gold standard in terms of how to have shared decision making between the oncologist, the primary care physician, and then the allied health professionals. So I think that that's an area that does require a bit of research to determine not only communication, but to be able to determine how we can have shared ownership in terms of managing the patient. I think there is a growing need for research in that area.